Oh, sports injuries.
Yeah, a lot of kids are getting injured while playing sports, and it's not uncommon to see broken wrists, torn muscles in the knees, and they're little. You want them to have a nice athletic career, so you got to prevent them. So our Better Buddy Melissa Cole, she went with an orthopedic daughter. Orthopedic daughter?
She has an this doctor might have a daughter. I don't know if she's orthopedic or not.
An orthopedic doctor in Mansfield to learn more about these injuries and how they can be prevented.
Take a look.
The most common problems that we usually see are fractures. From old people slipping and falling, from young patients getting injured playing soccer, football, or other sports.
Abby Bundy is one of the young patients Dr. O'Connor is referring to.
I play basketball, cross country, softball, and I dance a little bit too.
She's no stranger to the sports center here in Mansfield Center. Abby's had several sports-related injuries, including trouble with her knee and a broken wrist. She's here today for a checkup with her mom. Everything looks good and she's healing well.
We decided to come to Dr. O'Connor because he specializes in sports medicine and he's an athlete himself, and we learned that about him. So we decided that who better than an athlete to treat an athlete.
Dr. O'Connor tells me overuse injuries are the most common when it comes to kids and teens like Abby. They're playing the same sport all year, in school and on travel teams, so there's no downtime for the body.
So is this an example here of a fractured wrist?
Yes, this is an example of a fracture that's actually in the process of healing. This is a left wrist of an adolescent. A fracture and a break mean exactly the same thing.
Okay, so if you fractured your wrist, you broke your wrist.
You broke your wrist.
Okay, and you're going to need a cast.
Most of the time you're going to need a cast, with the exception of some fractures that are just very small. Those can get away being treated in a removable splint.
Recovery time is usually 8 to 10 weeks, but in some instances, the child can go back to playing sports after 6.
Something like soccer, they could go back to playing soccer while their fracture is still healing.
Dr. O'Connor also sees a lot of torn ACL muscles in the knee, often caused by landing improperly, especially in basketball.
A long recovery period, anywhere from 6 months to a year before you can really get back to competitive athletics.
He taught Abby some techniques to keep her body in check while playing the sports that she loves.
If you warm up a very little bit first and then start stretching, you have more likely a chance of not pulling muscles and keeping things how they should be. Okay. And just keep stretching and definitely drink your milk.
So hopefully she won't come back for any more casts, but if she does,
we love coming here. We do. The staff is great. Kristen and Michaela are fabulous. Dr. O'Connor, he's so personal. He speaks to Abby, I think, like she's, granted she's the patient, but he speaks to her like she understands, and he speaks at her level. And he's just really been wonderful with her.
All right, now we want to let you know the Sports Center is affiliated with Windham Hospital. Dr. O'Connor is accepting new patients, so go to our website, get all of the information, and check it out.
Yeah, good information out there. And we're going to be right back with a great blogger and a great summer recipe.
Oh, thank God we're not cooking this one. We've got a professional.
Yay!
Stay with us.